Ladies and gentlemen, this is your captain speaking. We're expecting the clear sunny skies on our way to Chicago today. I'm sorry, Captain. Do we have any doctors on the plane?
I'm a student doctor.
B-21? All right,
I'm a student doctor. How can I assist?
All right, we can go to B-21 here.
B-21? I actually have my team here. We're traveling to a conference.
Oh, okay, good. Patient's having a little bit of trouble here. If you want to talk to him, you can.
Okay, fantastic, guys. Hey, let's go ahead and run this like we do in
watch out there. That's the exit door, though.
Let's go ahead and run this like we do. Let's go ahead and start with ABCs, okay? So please check on this patient. Let's get a history.
All right, I'll take history. Sir, can you tell me about your film? What's going on?
Can't breathe?
Can't breathe? Okay, do you have a history of asthma?
Any crackles, rails?
His?
So head asthma.
Okay. Do you have an inhaler
Diffuse
on you?
wheezing and bronchi.
Any medications?
I
Sternal
can't
border
use
bilateral.
Okay, and can you grab me a first aid kit? This is playing the medical.
Yeah, we can get that kit.
Go ahead and radio, give me some, could you please get me somebody to contact on the ground?
What?
A medical team on the ground that can give me some
Medic control on the
assistance.
ground?
Yes, please.
Okay.
Like we have wheezing bilateral in the lungs.
Okay, so the right.
My bilateral in the lungs. Sir, what's your name?
Doctor, this is the kit that we have on the plane. This is all we got here. Whatever you need,
bilateral.
equipment there.
Okay.
He's
Mike, we have strong bilateral.
What's your name? Can you? John. Hi, John. My name's Mike. This is my team. We're going to take care of you. Can you tell me? You said you have a history of what? What was the problem?
He said asthma when he was a kid.
Does it usually get exacerbated on planes?
We got a pulse ox monitor on there. I'm BLS certified.
Last week.
An inhaler? Yeah, let me find
Okay,
that.
guys.
Mike, we have strong bilateral pulses.
Under the weather.
Yeah, we can get him hooked up there.
Okay, great.
Should be coming up there
Okay,
shortly.
awesome.
Sir, I'm just going to take a listen to your heart. Okay?
It's worse on the plane.
Worse
on the plane.
This is all we got. Is what's here in the kit. So
How cyanotic
I did find an inhaler. If you'd like an inhaler.
How cyanotic is it?
It says albuterol.
My heart sounds are normal. Am I seeing any cyanosis?
How cyanotic
Just
is it?
tachycardia.
Okay.
It's coughing as well.
We also don't have any other access. We have a pulse ox and we have an albuterol inhaler.
You have an albuterol inhaler. Do you take albuterol? Is that your normal medication?
What's his
Not
pulse ox
albuterol.
currently?
Pulse ox is 89.
89.
Okay.
There should be oxygen on the plane. We can pull down one of the facial masks and that's oxygen.
Okay, that's a great idea.
Wait, pull it down from the ceiling?
Yeah.
That's going to put all the oxygen.
It's okay, just do it.
Everybody, I'm going to have to drop your oxygen mask, please, okay?
Just notify the other passengers to please stay calm, okay? We don't want anyone
So we're
to
gonna
get
put oxygen on you, right? All right.
Okay, hey, listen y'all. We got somebody up here who's having a little trouble breathing. We're just giving him a little bit of options. So you may notice that your face mask is in the drop in front of you. You don't got to put that on right now. You can just let that be. Don't be alarmed. And we will be coming around with better service in about 4
All right, I'm gonna put this on. Okay, I'm gonna put this on your
Oxygen mask is administered on the patient. Okay.
Am I seeing, so his pain was in the lower right abdomen. What am I seeing constitutionally? Any swelling? Is the skin febrile? Like, is it like cold, clammy, hot, temperature-wise? Is there any palpable masses?
So just take nice deep breaths.
Exposing the leg.
Get you checked
And
out, okay?
the abdomen.
Just relax.
Tenderness.
Take good deep
And the
breaths.
right upper
All right.
quadrant.
Okay, sir, can you point to your tenderness with one finger? Okay, so it's right upper quadrant.
Mild tenderness.
Okay, I'm checking his legs.
Am I able to palpate his?
Sir, just keep taking
Any
good deep
swelling
breaths
in
for me
one
and
side
just relax.
ears,
All right, we're gonna get you
hip
checked
percussion.
out and make sure you're doing okay. All right?
Okay, I'm checking his legs. Is there any peripheral edema?
Clavicular line, sorry.
Is there any peripheral edema noted in the legs?
Can you tell me where's what would be the?
No edema? Okay.
Quick sound. You'd have to.
Hey guys, let's go ahead and lower him to the ground.
Could you follow?
Could you let me speak with us? Okay.
Help us lower him down to the ground gently.
I want everybody to pay
We're going
attention
to
here.
scoot him to
Keep
the
his
aisle.
neck straight.
Pay attention to it. What are you doing to me? I'm going to have you just lay down
Stay
like
away
that.
from
It's okay, sir.
breathing
Just
deeply.
deep breath.
Hey, Kate, would you talk to the pilot? He's gonna give us the time that he can land this plane if he
Great.
needs.
I'm good.
Okay.
Consult medical.
We got you on the mic with the pilot here.
Okay.
Hi, sir. Have you made any contact with medical personnel on the ground?
Has our pulse ox improved with the oxygen from the mask?
You got a moment. You're talking with them right now.
Can we see this?
Okay.
Can you,
So we have a patient that's
91, so slight
that
but not
is
much.
dysphonic and has had
Good deep breaths for us, all right?
Hold on.
On my lower extremity, am I seeing any sort of extension of the dogs.
I was thinking.
Okay, so I'm concerned about a couple things. I'm concerned about
Yeah, this
exacerbated
is-
asthma.
this is,
I'm concerned about a pulmonary
this
embolism,
is, Dr.
first and
Chuckles,
foremost.
Ground Medical Service.
Hi, Dr. Chuckles.
Maybe
This is
COPD or
Phillips.
something
I'm on
like
board
that.
with
Exacerbation.
You what?
Speak up, I can't quite hear you, it's a little static.
No, I'm on a patient with a plane who's
that's what I wanted.
experiencing
Thank you.
short stress, has history of asthma as a child.
How are you feeling right now?
It
hurts up here. It hurts up here.
He's having a real hard time with it.
Okay, how long's a while?
We have an albuterol inhaler and we have pulse ox
I went to my doctor.
We don't have access to
They
anything
said my
else
liver
besides
tests are
oxygen on the
abnormal.
plane.
We don't know
That has
what's
been
going on.
administered.
Okay.
But right now,
Do
we're
you
trying to
drink?
get the pilot to see when we can land as soon as possible to care for the
Sometimes.
patient. What do you recommend that we
Do you any illicit drugs?
Okay, so you're just given
Do you have any other
and oxygen.
medical
Yes.
history?
What do you guys think is going
You've been
on?
hospitalized for anything?
We're still examining the patient.
Just keep taking nice deep breaths for us, all right?
All right, when you have a better idea of what's going on, there's a lot of people on the plane waiting to get to go
What
to
type
their
of,
destination, so it takes a lot.
what type of imaging equipment do we have? Like, do we have an ultrasound?
Team, let's stop and take a break. Let's take a breather. Let's get a review of symptoms, okay? We have pain in the bottom right quadrant of the
Upper right
quadrant. They had dyspnea. We have a low O2 sats. The patient has a previous history of asthma.
Pulse ox is dropping again.
Okay.
Been sick a week prior. So we have a better idea of what's going on.
Okay. Let's check that first.
Did you get that inhaler for us?
Yeah, we got
Okay.
the inhaler a while back.
Okay, his pulse ox is still dropping.
Pulse ox still dropping.
What
Go ahead and
medicine?
Should we administer the
Sir, are you allergic to albuterol?
No.
Okay, so go ahead
CLS
and,
kit, so we got lines, whatever you need.
All right. Okay. Take a puff of this albuterol, please. All right. And let me know.
do we have an IV line established yet?
No, I can do that for you.
Okay, yeah, go ahead, please.
Let's go ahead and run through what else is in that first aid kit. Do we have any aspirin?
We got line in the right arm there.
Okay, line established, Mike.
Inhaler helping?
We do have some aspirin. We give this patient some aspirin as well.
Okay, is your pain still there?
Yes.
Tablets of chewable
Okay.
aspirin.
Can you take this aspirin, sir? This is hopefully the next.
Just keep taking good deep breaths for us.
Okay.
Have you traveled anywhere recently?
2 minutes? No.
Okay.
2 minutes.
Come on, guys. Just keep taking it.
Okay.
It's not. Are you feeling any better after that albuterol?
Same thing.
Okay, the albuterol's not working, so it's something else.
Do we still have money?
Check his legs again.
Send him on
Is there any change in
Are
his legs?
my lungs any change in the sound?
No change in legs.
So
Mike, can we have it take
Still
another,
bilateral crackles?
dose of albuterol?
Yeah.
You had
Okay.
diffuse wheezing and bronchi at the sternal border bilaterally, and you still have.
Sir, we're gonna have to take another dose of albuterol. So take a deep breath for me here, all right?
Okay.
All right. Albuterol's been administered.
Are we noticing any tissue changes or anything that I can see?
Just keep
Is there
taking
any
good deep breaths
jugular
on that
vein
mask for me.
extension?
Any JVD?
No.
Okay, is he using expiratory muscles as well, accessory muscles? No, okay. So, hey, I mean, it's a slight actually, but it's slight alcoholic.
Ladies and
Slight
gentlemen,
alcoholic
this is your
drink.
captain. Can I please get an update as to what's going on? Do we need to land this thing or what?
I recommend it, that we land this plane.
Yeah. We have the ground crew we can consult because
Yeah.
we have the airline has this person that we can consult.
They said we have a better idea of what's going on.
Okay.
Yeah, they won't let us do that. So. Okay, so what's in the differential now? We talked about exacerbate. Okay, now let's think about liver enzymes elevated.
Yeah.
I know I don't have any definitive evidence that he has elevated liver enzymes right now. He said he does. And a previous doctor was it. I'm not seeing
Yeah,
any other signs.
it's not radiating out
I
anymore.
don't know.
His-
Think about the
his
PERT
O2
criteria.
sat-
I want to rule out pulmonary embolism. Think about the PERT criteria.
Ladies and gentlemen, are we landing this plane? Need a definitive answer, please.
I'm a student of Dr. Mike Crowley, and I say we land this plane.
Explain.
At the soonest convenience, please.
Any reason why?
We have a patient that I'm concerned going into hypoxemia. I'm honestly.
His pulse ox is still bad.
All right, team, that's time. Well done.
Ladies and gentlemen, Mr. Captain speaking. Captain Chuckles. Oh, nice quarters to Chicago today. Yeah, please.
I'm sorry, Captain, to interrupt, but do we have any doctors on the plane, please? Can we get a physician to seat 21B, please? Physician to 21B? No. Are there any doctors on the plane?
Yes, we have
Okay,
several
thank you.
doctors.
So, what do we have going on here?
All right, this gentleman here was having a little bit of shortness of breath. I figured we'd try to see if anyone could help him out.
Okay. What's your name, sir? John.
Okay, John, my name's also John. This is my team. We're going to be taking care of you, okay?
Okay.
Grace, can you go ahead and just do a physical exam?
John, can you talk to me?
Do we have, what resources do we have on this plane?
Oh, well, I got a med kit, yeah, with a little monitor on it.
Can you bring me everything you have?
I can grab it.
I'll grab that.
Okay, here's the kit. The monitor, as soon as you get it set up, it boot up here, and that's got IVs, wearing stuff, and lots of medications in there.
Is any of your staff able to help us?
Well, I'm certified in
Thank you.
That's about as much as we got up here.
Sorry, sir, we just have to go through the.
Good.
Do you have any allergies, sir?
No.
Okay, thank you so much. Do you have any past You alright?
Yeah.
Okay, deep breaths, deep breaths.
How long have we been in the air? What's our
Flight time is, we're at about an hour, about 3 hours. We're flying to Denver out of Dallas. We had to circle around a little bit when taking off because of some storms that were coming in. So about an hour in, we should be wheeled down about an hour.
We still have an airway.
Isn't that right?
I feel like you're in the wrong
Just coughing. Passenger, know anything about the passenger?
It's hard to breathe. It's really hard to breathe. It's just light.
Anyone have an inhaler?
Doc, excuse me.
We've got a medkit from our flight.
What's going on? What's going on?
Sorry.
John, we've got an inhaler. Go ahead and just take a deep breath.
I had asthma when I was a kid.
Yeah, and did that go away? No allergies.
Yeah, this has been happening a couple.
You're just going to walk the exit door there?
Couple of months, off and on.
Yeah.
That's
when was the last time you had a attack like this?
like a week ago.
How is he? What about
Just pain?
or breathing difficulties?
It hurts right
Here? Yeah.
right here.
Feeling
Right
pain?
here.
Okay, yeah. Okay, we'll take care of that.
So you did have right upper quadrant
Okay, you see it's sharp right there?
mild
It's
right
staying
upper
there?
quadrant tenderness?
Huh?
Is it staying right there or is it
It's
still?
normally a mild upper quadrant tenderness.
Stays?
It's obviously very
Doesn't
difficult for him
move?
to breathe.
Yeah.
I haven't found any real abnormalities with
Okay,
his
we'll
head.
take care of this as soon as possible.
Were we able to get
Do you
some-
He doesn't have
take
some
anything for the
speed.
asthma? Did you use for the child?
We can get that. We can get that monitor set up for you.
Okay.
Yeah, we got
Sharp
that set
pain
up.
on,
He
he has a dull pain on his right side on below his
You feel
right
it.
here.
We are in normal intensive, John. We're actually slightly elevated diastolic. Tachycardic at 120.
And have you been noticing
Respiration rate at 28.
Do you have oxygen on board this flight?
Yeah, white stuff.
Temperature is 38.
Yeah.
I think I got an oxygen tank here. Let me go see if I can
What do
find
you do
it.
in Dallas?
I just work.
Yeah, what do you do at this work?
Office job.
Yeah, I got a small canister oxygen.
He had asthma as a child. He doesn't
He has
remember
asthma?
Yeah, he doesn't remember what medications he took.
Let's go ahead and
As a
put him on
child,
this.
but
We have a
just
nasal
about
cannula
tablets,
here,
on
so
and
we'll
off.
put him on oxygen.
We're going to give you some supplemental oxygen, if that's okay.
You want to give him, he has asthma, so you want to give him more albuterol, we can give him doses already.
Let's do that. Let's give him a nebulized albuterol.
We ain't got nebulized here. We just got the albuterol.
Okay.
Okay.
I don't have anything to send.
Okay, John, we've got some more albuterol here.
It's just when I got on the plane. The
Yeah.
plane.
Joseph, just coach him through the cost of that albuterol.
Pain,
Okay, John.
It's also been there always.
Can I get him for the albuterol? Go fast.
Yeah.
I went to my doctor
Yeah.
for the pain.
Yeah.
He said I had some weird test results for my liver.
Yeah.
They were
So
high.
our physical
Oh, I
exam
don't
is
know.
fairly clear.
Yeah.
We don't
In
know
terms of the
what's
sputum,
going on.
and
It
then
just
also
hurts.
he has
Yeah, I'm so sorry to
right
hear
upper
that. Okay,
quadrant
we'll take care of
tenderness
this.
or some mild
Do you
pain
mind
there.
answering questions?
No deformities in
Okay,
his
John,
legs.
we've got some
He's
albuterol. This
tachycardic
is medicine that's going to help you breathe better. I'm shaking that for you.
Yeah, he has.
Can we repeat our vital signs, please? Scream.
It's also going to come out to the pain.
Okay. Oh, I'm sorry. We'll get guys. Let's get a quick history from Rich. He's been doing it from
Yeah, a child for a child he has asthma. He's
Doctor,
he doesn't know.
I'm sorry to interrupt here, Doctor, but the pilot is asking if we need to consult any medical ground control or land the plane or anything. He's asking to talk to one of the physicians.
Yeah, let me talk to them.
Okay.
John, how are you feeling after that?
And
We'll talk to that microphone right there.
having just pain for the past.
Hi, this is Joseph. Nice to meet you, pilot.
Saw a doctor for it.
Hi, so we have this patient on the monitor right now. It looks like he might be a little unstable. We're concerned about his breathing. We want to actually go ahead.
I'm a doctor in philosophy.
Excuse me?
I'm a doctor in philosophy. You want to talk to the ground crew?
Yeah, actually, we really talked to
Let's get
I've never smoked.
Hi, this is Dr. Chuckles on the ground. We're just talking to my brother.
Hey, Dr. Chuckles. I just wanted to give you an update on flight status with a patient here who seems relatively unstable.
Okay.
Okay, it looks like he's having some trouble breathing. We've administered some albuterol. We're monitoring him on a cardiac monitor right now, as well as a vital signs. And we've seen some mild exacerbation here. I just wanted to give you a heads up in case you need to facilitate any emergency procedures. I'm not a pilot, so according to the protocol, we need to follow the protocol for medical emergencies.
Okay, we can't have a we need this lady to land now, or
Diffuse
can it wait?
reduced wheezing.
Let me consult with my team one second, please.
Bilaterally at the sternal border.
Okay.
No,
So,
Okay, hello. So our patient seems to be deteriorating slightly, and he might need some kind of emergency landing. So we're going to go ahead and ask you to prep ground for emergency landing. Thank you.
Okay.
Are we ready to
Can you think anything that might make this episode a little different than the one
Yes. I'm with the ground crew, and it looks like the best thing to do right now is initiate emergency medical protocol. So I'm going to send your hands on the patient who's any questions, concerns for him. All right, thank you. I appreciate it.
Is this what you're looking for? Does it help at all if you like move forward?
That's it, thank you.
Try anything that helps with the pain or the difficulty breathing?
Just rest.
Yeah. Hear nothing, and then what about the pain here? Anything that's helped that or made that any better?
Just always though, comes on and off.
Yeah, and how long has that been going on for?
Years.
Years. Okay, I'm sorry to hear that. I'm sure your doctor is taking care of that. Do you mind if we just get some more information about surgical history and other past medical history?
175 milligrams of solumedrol IV.
And when was the last time you had it?
Just at the airport.
Just at the airport.
He's talking to us.
Solumedrol.
History of heart problems or? No.
Ladies and gentlemen, this is Captain speaking. We landed in Grapevine, Texas. And we're hoping that
Please repeat our vital signs.
you there.
Sure thing.
And we're going to disclose the patient.
That's time, that's time.
TCEP Team 1. Okay, so great communication. We gave you a 4.5 out of 5. Closed loop, we still like to see closed loop. Remember to feed back to one another. I need you to do this, I'm going to do this. Remember that just so we can sort of see it here. It's very difficult in this setting and in the sort of the plane and the aisle and by the exit door, but still, we thought it was great. Teamwork, we thought all around great. Everybody had a role, everybody did their role. 5. We give you 5 out of 5. Empathy. So where we've been keeping this mostly flat and then trying to compare the teams at the end, we just, regardless of that, we gave you what we just marked as a plus on empathy. We thought it was good. Overall, communication with the pilot, with the patient, it was solid. And then when it was time for oxygen, and the first thought of the team was, well, we're going to have to drop oxygen masks to get that. Maybe they have an oxygen tank on board, but you thought of that, said, yeah, well, we're going to have to drop it for the whole plane. Yeah, let's drop it for the whole plane. We're trying to take care of this patient. We thought that was great. Assessment, we thought interpreting findings for everything you had to work with on a plane with the limited resource, we thought it was great. We scored you 4.5 out of 5. And decision making, overall, we scored you on this one a 4 out of 5. So definitely we still felt like above average. It was a little bit maybe slower than we would have liked with going ahead and continuing on with the albuterol treatments that you may want to sort of keep on going with. And then we were looking for you to maybe think of additional thoughts. Albuterol, what about atropine, what about steroids? Maybe you have them or don't on the plane. We'd like to see you ask for everything you might want and then get told no, rather than assume you don't have tools at your disposal. But let me say, TCOM Team 1, first year medical students, great job on a finals case at Sim Wars. We scored you an 18 plus. And again, remember, out of this on the 4, so basically out of 20, and then a plus or no plus, you got a plus. So great job. So let me talk to UT Houston. Also an excellent job. In this case, we gave you a tiny edge on communication. We thought it was just a click better and scored you 5 out of 5. We thought the communication was great with the passengers. The historian talked to the entire plane to try to help keep them calm, which usually gets deferred to the flight attendant. That was pretty strong, we thought. And likewise, the teamwork was as good as it was in the other times, and the other time that we saw you for sure, and we actually scored you like TCOM a 5 out of 5. Empathy on this one, I gotta say that talking to the passengers and then having the thought, like, I've got to give medicine to this patient. Does anybody have an inhaler? We really like that kind of thinking in EM. Here we are, we're on an airplane, who knows what the plane has? Maybe a passenger has an inhaler. We just thought that was strong and outside the box thinking. And so we actually plussed you on empathy there. So we still did not assign a numeral to that. But on assessment, honestly, we thought you got it all. We watched her physical exam as Grace has taken the physical examination of this patient in a squatted position with a lot of people talking around her. She kept concentrated, got the liver exam. We really were impressed with her exam on this one, and we actually scored the assessment a 5 out of 5. And on decision making, we thought a great job overall. So in addition to thinking of the albuterol and going with that, we liked the frequency, and let's get some more, and let's ask for ipratropium. I think we said atropine, great. And then also ask for steroids. So definitely thinking, give me what I need to take care of this patient, and meanwhile still communicate with the pilot and assuring a landing. Really a great job. We scored you at 19.5 plus on the empathy. So this year's Sim War winner is going to be UT Houston.